Good evening, all. It's always a pleasure to host Dr. Patmaja Krishnan in our show. Today, we are doing the 27th episode of the Kerala Society of Ophthalmic Surgeons Ophthalmology PG Classroom. We had gone through many case presentations, spotters, clinical research studies. Last time we had gone to evaluation of doses. So multiple things have gone through this. And now this time we are having a very, very unique sort of a topic today, because all of you will find that you have to write theory exams. And unlike the time when we are writing a lot of theory exams in 10th standard or 12th standard, now for a long period of time, we have not written a lot of theory exams. During the MBBS also, after each course, there will be a theory exam. But after the start of PG, you are not writing long essays or long questions, or not pacing the answer paper or planning to write on that. Here we have Dr. Patmaja Krishnan, who was the professor and head of the Department of Ophthalmology at Calicut Medical College for a long period of time, and then went on to become professor and HOD of MES Perinthalmanna, currently emeritus professor in MES Perinthalmanna. She has 4 decades of experience teaching postgraduates as well as graduates, and she will be talking to us. She's an extempore speaker, wonderful speaker, very eloquent, simple, to the point, and will cover everything. So she will be speaking to us today about the nuances in theory writing. So how are we going to write the theory paper and make the examiners spellbound? We will hear for the next half an hour to 45 minutes from Patmaja Madam the tips of how to write a theory exam in your PG. Over to you, Madam.
Thank you so much, Gopal, for all those nice words you've said about me. It's very true that I've been teaching for a long time. I've been valuing papers for a long time. And definitely, I have a few tips and points to make. I know that on the group you had posted about the theory paper being every PG's Waterloo. In that context, I would like to say that at Waterloo, the indefeatable Napoleon was defeated, but the Duke of Wellington won. So even if it is your Waterloo, it could be the Waterloo where you won rather than where you lost. Now, the next thing is that when you prepare for the theory, I'm going to say that actually writing the theory in a way is easier than the clinical. Just think about it. In the clinical, the questions that are going to come from the examiners are honestly not predictable. And I have said this before and I'll say it again, that no 2 exams and no 2 examiners at 2 different exams will behave in the same manner. So in the clinical, there's always, if you're clever, you will lead the examiner the way you want. But equally, sometimes you say something you wish you hadn't, and you take the examiner on a track where you didn't plan. But think about the theory. The question is fixed. It's there in front of you. You know that that is all. There are no follow-ups to that. This is the question that you have to answer. So in many ways, I'm going to argue that it should be easier. It should be less stressful to write a theory paper than the jittering and the heartache that goes on, because even when an examiner asks you a question, all the time you're worrying about, okay, I've heard this one, heaven knows what he's going to ask next. Whether it is the theory or the clinicals, of course, preparation and knowledge will always have to be there. I've said this before, and let me say it again, that ophthalmology or any medical subject cannot be learned from the text. It can never, ever be learned from the text. There are nuances to every disease. There are differences in the way patients will react to the same disease. And I know what a lot of ophthalmology I've learned from seeing a patient, worrying about what must be happening, going and reading the book, and then coming to having my ideas made better or easier and to understand that disease. So seeing patients in the OPD, examining them diligently, picking up their clinical signs, thinking about it, going back to the text and reading, rather than reading just the text, which becomes very dry and dull. But when you've read about the topic after you've seen a patient, the disease, the subject becomes much more clear. I'm very happy to be talking to you about writing the theory paper, but I'm even happier that I no longer will be valuing these answer books and after that agonizing about the marks that I should give. And a lot of my talk then is going to be from the perspective of me as an examiner, me as the person who you have to convince that you have the knowledge for a pass. Again, a lot of what I say must be known to you, must be familiar to you, and consciously aware of many of the things that I'm going to say. And my job is just to crystallize these ideas. I know what a lot of happiness it gives me when what I thought was right, someone else tells me is right. So I'm going to help you to understand what you should be doing to convince the examiner that you are worthy of becoming a consultant ophthalmologist. I'm assuming that by the time you take your final exams, you will definitely have the knowledge that it takes to pass. Again, every postgraduate feels that if he doesn't know everything about ophthalmology, he will not pass. But think about it, there is none of us who can claim that we know all there is to know about anything. And with subjects like ours, which are evolving every day, we know that this is not possible. But go through your question papers, the theory papers, and you will find that the human model has not changed. The basic anatomy and physiology have really not changed. Our understanding might have increased. We might talk about things, say the Duas layer or the muscle pulleys, but the actions of the muscles and the innovations of the muscles haven't changed. So a lot of the questions that are going to be asked, and what many postgraduates talk to me as basic. I used to worry a lot, but people would tell me, Madam, namku basics aana riya. And I kept wondering, what is basics? Basics means what? And then I realized that what they're trying to tell me is that they don't understand the foundations, the fundamentals of the eye, the way the eye works, and what happens when things go wrong with the eye. And that is what they want to know as basics. Now, in a day and age when we had fewer textbooks, when knowledge was not as explosive, our first attempt was to actually understand every word, what was being taught to us or what we were reading. And I advise each one of you to go into the words in the text to try to understand the idea, the concept behind that. So whether it is the theory or the clinical, your knowledge is what you actually know, not what you read, not what you learned, not the word that comes to you. I have this habit of pulling up my PGs all the time. When they use a word, okay, what did that word actually mean? Why did you use that particular word? Is that what you meant when you said? And very often, all of you, I'm sure, use words interchangeably. You heard words and you waffle. You hide your knowledge or your ignorance using a word which sounds good. I would strongly advise that if you break it down, the examiner, as you all know, knows his subject, or at least knows a lot of his subject. There are many times when I worry that probably my postgraduate who's been reading a lot more than I have been and retaining of late, probably in some aspects might know even more than me. But your duty is not to teach me. I'm not reading your answer paper like I would read a journal paper or I would read a textbook. I'm reading your answer paper to know what you know. And unless you put down what you know, I do not know that you know. So you can't assume that there is knowledge on my part. At the same time, I have asked a specific question. Now, the paper setter has asked a question with the expectation that this amount of what you might call basic knowledge, the knowledge that you really need if you have to deal with that condition as you go out from here and become a practicing ophthalmologist. So your aim is to convince me that yes, you do have the wherewithal to be a safe consultant ophthalmologist tomorrow, which is what the examiner is certifying you for. So from the perspective of the examiner, the questions are asked to test you for what, again, what you might call basic knowledge. The knowledge that is really a must, the knowledge that you need inside you if you are to practice. But you've been working 3 years in ophthalmology. Over that period of time, we are assuming that you have also been taking an active interest in the way our subject has been developing. So we would expect the newer trends in diagnosis, the newer trends in management, the newer drugs that have come. And of course, there is a whole paper, every PG subject worth its name has something called recent advances. Very many times, many of these recent advances might fall by the wayside. Many of these recent advances will become current practice tomorrow. They will be what all of us will be doing. But the idea is, do you know what is happening? Things that, for example, in my day, macular hole, you did nothing for it. Oh, sorry, that was your vision. There's nothing we could do. Diabetic retinopathy before my time, or even when I was a PG, horrible things like taking off the pituitary gland for PDR, things that we would never think of now. So things have changed. They've changed for the better in so many, many ways, as you will be aware, and as I am acutely aware. Gopal spoke about the 4 decades. Add to that a bit more when I was a postgraduate. So there's been a long period of evolution. So I'm trying to tell you that knowledge of what the eye is, how the eye sees, what happens when things go wrong, either with the structure or the function, and what can be done to confirm that what is wrong is what you think it is, and finally to manage it is what ophthalmology is all about. Let us go to your theory paper now. Every theory paper that I'm sure there are some of you doing the DNB, there are some of you doing the KUHAS, the MS. But every theory paper, whatever the stream you're in, has a fixed pattern. The fixed pattern is sent to the paper setter. The paper setter has to set questions as per the numbers specified, the marks specified. So in the KUHAS, which is the one that I'm very much more familiar with, I've not had to value DNB papers, so I will restrict myself. Anyway, never mind the question paper that is set. The principles of answering it to me are very much the same. So in the KUHAS question paper, we have this larger essay for 20 marks. And then we have a set of 8 notes or shorter essays for 10 marks each. My first advice to each and every one of you is that you time your answer to the marks that you're being given. So if you have 3 hours to complete this paper, okay, 3 hours is 180 minutes. And you say that for every 10 marks, you have roughly 18 minutes. And for the 20 marks, you probably have 36 minutes. So the first and the most important point for me when you're writing your theory paper is that you decide that within those 18 minutes, that question has to be done within the 18 or the 36 minutes. You really need to complete that. The next is, in what order do you want to? Now, this is to me a very tricky one. I know that lots of people will tell you, and you will also believe, that writing what you know is the best one. So you start with the question that you're well prepared for, that you know all about. But the problem is, and I've seen this happen time and again and felt sorry for the candidate, that you write everything you know for the first one. It may be a 10-mark question, it may be a 20-mark question. You write details which might or might not be asked, or you elaborate what needed to be said. Net result, you don't have time for the answer. Now, the result is that if you had written something on the 10-mark paper, which was not completely off, I would be obliged to give you 4 marks if I thought it was inadequate, 5 marks if I thought it may not be everything, but there is sufficient knowledge there. Whereas, if you write everything on the 20-mark question, there is this natural bias. How much ever you have written, there will always be something more that possibly you could have written. So on the 20 marks, I might give you 16, 17. If you wrote very well, if you wrote average, I might give you 14 if I thought, yes, it's good, but could have been better. But I'm never going to give you the 20 out of 20. And if answering that has made 2 other questions written badly or not attempted, then you've lost a lot more than what you have gained. So each of you must make your own decisions. If you're going to write the one that you know best, you must tailor what you are writing to the marks that are there, to the time that you have for that amount of marks. I will say this again and again, and I'm sure that many of you would have experienced the same. You write one answer so beautifully, and you end up not attempting another answer or not having the time to think. So actually, there is a role for writing the answer that you don't know too well and taking that extra time to think about it and write what comes to you and then leave it. Okay, you couldn't use those 18 minutes because you didn't know. Every examiner approaches every answer as a fresh one. We do not carry that because you wrote one answer well, when the next answer is abysmally bad, we are not able to give you the marks that you think would be. There is a halo effect. If you've been writing 4 answers very well and the 5th answer is slightly off color, we might still give you an extra mark, thinking that yes, maybe the broad-eyed knowledge in there, it's only in this small area that the candidate did not know. But if you write one superlatively and then all the others are average or some of them below average, then the assumption is, look, that's the only subject or only topic that this postgraduate knows. His knowledge is not deep or broad enough. So these are the pitfalls that you must guard against. You must answer every question. Start with the one you know the best. I know people argue that it will give you confidence, but I know that when I've taken a paper and there's been a question which I don't like, I'm not so sure, I feel I haven't read enough about it, I don't know the actual answer, what was expected of me. And as I'm writing all the others, at the back of my mind is the worry, gosh, I'm going to come to that answer and I really don't know how I'm going to deal with it. So if you get that one out of the way, leave paper at the end of it. If you have the time, go back, think and answer. And of course, for every question that you are answering, take the extra 2 minutes to think about the answer. Again, at the back of every answer book, there are pages for rough work. Onto that, when you think of that question, and I mean question, postgraduates do another thing. You read that question very, very in a big hurry and you latch on to one word in that question and assume what was expected of you. Read the whole question. Take a few seconds to digest that question. Take time to understand possibly what exactly is your examiner expecting of you. Then quickly jot down the points that come to you when you think about it, and then start writing. You start writing. I've seen this also, and you feel really sad. I've seen it so often with undergraduates, and unfortunately even with postgraduate exams. The first answer was the right answer. The candidate was on the right track. And then somehow, somewhere along the line, he reads the question again in a hurry, and then decides that, no, this is not what they expected. And then the whole thing is slashed off. And the second answer, which is the only one I'm going to correct and mark, because that is what the candidate thought was the right answer according to him, would be completely off. And I have no time now to go back and read everything. And there's no reason why I should give marks on an answer which has been cut. Again, who suffers? You do. So please make sure that you understand the question. The question is to know what you know. The knowledge is what you already have. Your aim is to show me that you know, but I will mark you only based on what the question asked of you. So take those 2 minutes off that 18. It is not a waste of time. It's vital, well spent time to decide on what you want to do. The next is when you come for the Viva, every one of you will come well dressed, will come with a smile on your face, hopefully, but none of you would come dressed dowdily, your hair in a mess, because you would like examiners to have a good impression of you. But when it comes to your answer papers, unfortunately, you don't give us the same respect because you write it so shabbily. And believe you me, that every paper which is difficult for me to read, and unfortunately, many of us as we get older might have difficulty deciphering what you have written. Sincere examiners feel guilty to mark without reading what the candidate has written. But every minute that you spend struggling with the word, you don't know whether this is an S or a G. I mean, after a while, you realize, oh, this is how this person writes a T, or this is the way the person writes an S. It is so difficult. And then you have to go back and decipher the words. Net result, when I'm struggling to read and I find that what is written is wrong, I'm so pissed off. I'm so upset with what has been presented to me that automatically when I have to give the mark, I will cut down. Whereas if you have written it neatly, it's a pleasure for me to read. And if many of the things you've written, I read, I know you know, and then you make a small mistake where it should have been this does not occur, you write that it does occur, then I give you the benefit. Okay, in the hurry, you forgot that this is actually the negative that you should have stressed, which by mistake you forgot to write the note. And I'm so pleased that I was able to read what you wrote so easily that I'm likely to give you the extra mark for that. I've said this so many times that people with poor handwritings at least should increase their font size. Not only is the handwriting bad, it is written in such a small font size, you're not paying for the paper. They'll give you all the paper you need. So write in large letters if your handwriting is bad. And please try to improve your handwriting before your theory paper. So what have I said? You need to read the question. Now, there are people who say, read the whole question paper before you start so that you pick up what you want to write first. I've been speaking to other examiners and they've said that, we always like the candidate who writes in the order of the questions. The big advantage is that you don't have to flip through everywhere to know. Of course, now with online correction, I know that if I have not marked a paper, the computer tells me. But in the old days, you worry. Is the answer there somewhere? Is it not there? And you keep on turning pages this way, that way to find. All the time that I spend unprofitably, not reading the paper, but trying to find the answer, trying to read an illegible word, is all time that I consider unproductive and which irritates me when it comes to having to give the mark. So please, there is value in answering the paper in the order in which it is set. Of course, if you firmly believe otherwise, it's up to you. This is just an opinion, but I know that it does help the examiner when it comes to valuing your paper. The next thing is you tend to, obviously you have to number what you are writing, but then subheadings under that also you will tend to number. Here again, there is a major problem. You don't know whether the 1 refers to question 1 and then the 2 that comes, you've moved on to something else, or is the second point for that. So I would advise that it's safer to bullet. It's safer to leave a space, a tab when you're putting points under. And of course, putting it in a point fashion. Let me say this also to all my DNB students listening in. Many years ago, I had the student who was taking the DNB exam. And every time she came back, and of course, maybe those days the theory was marked more strictly, I don't know. I always thought she was good enough for a pass, but time and again, she would fail the theory. And every time after the theory, she would come and say, I've done a good job, I've written it well. And it was so upsetting when she came back to say she had failed. Till finally, she told me, Madam, inki madhyai. The last paper I wrote, I said, to hell with it. I'm going to write only the points. And according to her, she wrote only the points. And that time she passed. My contention is that the points were the right points. When she started elaborating, probably in that elaboration, she said things that were not quite right. As students, you do it all the time. On the day of the exam, you suddenly have a brainwave. Suddenly things become so clear. And you tell me something that you had never read of or never thought of. But on that day, suddenly, eureka, you think that's the right act. What shall I say? Insight into something. And in the stress of that moment, you write it, which may not be right at all. It may be totally wrong. And any examiner who reads that gets upset. So there is value in writing to the point in bulleted to some the other thing is underlining. Now, if you keep underlining, undergraduates do this all the time. Everything is an underline, which again irritates when the whole answer is full of underlines. But you could underline where there is a subsection. You could underline what you consider was a key word, which you want me to see, which was vital to your answer. Underlining that way might help. But underlining, highlighting, whatever you're doing is going to take time from your answer. So there again, please think of the risk-benefit ratio as it were to that. But diagrams and flow charts, they always help. If you draw a diagram, and a diagram is not actually what it looks like, it's only to tell me the concept behind it. So if you draw a diagram to show me that you know what you're talking about, or you tell me a natural flow chart of how you will manage a condition or whatever, just that, which tells me you know, makes me not have to read through what you have written after that, because I'm happy that you do have the knowledge, which is, I'm looking for the basic knowledge. I'm looking for, and you also, at least a 50%. Though, of course, those of you who are good, there's no reason why you shouldn't get the 60 and the 70 and pass with flying. So before you answer, read the question, understand what the question expects of you, structure the answer to the question. Now, in this context, I was looking at old Puha's papers, and you will find that sometimes the same thing, the same topic would be asked as a 10-mark essay, Sometimes it would be asked as a 20-mark essay. Sometimes it's very specific. They want this, this, and this about that. Sometimes there is only the word, there is only a term, there is only a phrase. Like there was something on refractive keratoplasty for 10 marks. Now you will have to decide what are the points that you really want to make. Many of you, there is no time to tell me about the anesthesia that is given. There is no time to tell me about the exact steps that are going to be done. But definitely you must tell me what it is, what are the methods available, how does it help, what are the complications. Similarly, there was one on discuss the pathogenesis, clinical features, types, and management of amblyopia. Now in this, the pathogenesis of amblyopia, as you all know, is important. I need to know why amblyopia occurs, because what I would like to do is prevent amblyopia. You also know that management of amblyopia is important. You need to try to reverse the condition. But the clinical features and the types which will come as a natural consequence of pathogenesis will have less, what shall I say, relevance, less importance to that answer. So if I were you, I would talk about the pathogenesis. Why does it happen? And what are the reasons why the visual pathway in one eye does not develop the way it should? And then on the basis of that, you will tell me that I can classify amblyopia as this, this, this. And then the clinical features are common. There are certain features that you will tell me, right? And finally, you will tell me about the management of the amblyopia. Now, last paper, I wasn't able to find that question. I know that who has asked something about relevance of ophthalmology, neurology, something like that. Instead of asking you straightforward about neuro-ophthalmology or asking you about the role of, what shall I say, fields or whatever. There are some questions which are actual Googlies. They are bold at you just to see whether you can pick it up, correlate what you know and say. Now this is one such. Every day in the OPD, neurological patients are being sent to you. Why do they come to you? There is a fundus opinion that is sought of you. There is a field they want you to do. There are ocular movements that they want you to chart. There's diplopia they want to chart. These are all things that you've done in neurological diseases. The 20-mark question was to ask you, what will you do to contribute to the neurologist? You will detect the papilledema, you will detect not only which cranial nerve palsy is there, what is the nature of the diplopia, is the diplopia, how much is it, how bad is it, that it's improving on follow-up, or you will chart the visual field, show them what the field loss is at the moment. Is it going to remain the same? Is the vision worsening as the condition either improves, stays the same, or worsens? So if I know that many of the students came back and said, we never expected this. But you could have expected if you sat a moment and thought, neurology, where do I need to help the neurologist? And there you would have got your answer. Again and again, I repeat, think, when the examiner set the question, he had something in mind, and make sure. Now, the paper setter is not the evaluator. So sometimes as an evaluator, I have had a problem because I don't know, why did the paper setter ask it in this manner? But if this is the question, what I have to do then is I read a couple of answer papers to find out how did these students approach this. And this, of course, is very often with UG papers as well, before I start actually reading and marking. So remember that whether it's the clinical exam or the theory exam, we examiners have probably as tough or a far worse time than you have. We need to go through question after question, or paper after paper, and at the end of it, evaluate and weigh the things that you have written well and correctly against things that you could have written better or have written frankly wrong. What are the other things that I wanted to say? Okay, the next one is again very personal, something that has helped me and might help you. I've always believed in not reading till the minute I walk into the hall, whether it's for the theory or the clinical, or worrying about what I might be asked. I found that if you worry about, I didn't read that yesterday. Gosh, what if that comes? What if I'm asked that thing for which I'm not really prepared? I find that that amount of worry makes you less cool, makes you less able to concentrate on the things that you are being asked and to answer like I'm asking you to answer, structure your answer, formulate what you want to say, think of what was asked, think of what you are writing. So maybe none of you will take this advice, but go to bed well in time the previous day. Wake up early if you want. Quickly go through one or two things if at all you want, but at least 1 hour before the exam, clear your mind of everything. Think of anything you want, but not ophthalmology. And I found that then when you see your question, it's fresh. And however much you think you don't know, things will come back to you. They will come back out of your subconscious. You have heard of this previously, you have read it previously. And as you start now thinking about that question and that question alone, so much more. I have this advice for you too. From now, I would advise you pick up, don't read any particular, read as you're reading every day. Pick up any question paper and pick up a question from that which you haven't been reading for the past 2 weeks at least, or the past 1 month preferably. Time that question, like I said, and just start writing. It gives you a lot more confidence that way. I've had PGs who've done this and then found that, you know, I've not read, madam, I've not read cornea and retina for the last, I've read it in the past, but I've not had time because I've been worrying about squint or something else or neuro-ophthalmology. And the exam is tomorrow or the day after or next week. And I really don't know how I'm going to finish all that. But have you read it previously? Oh, yes, I have. Then in that case, take up a paper, take up a question on cornea and retina, and just see what happens. Just see how poorly you perform. I can assure you that if you have been reading and trying to understand, you will surprise yourself by finding how much you knew that you thought you didn't know. I don't know what the time is. I have said, okay, fine. It's only 7:30. So my advice is don't worry that you have not read it the previous day. Not important at all. Read regularly, read every day, understand what you are reading. Let whatever you read seep into you, get into your subconscious, and let it come out at the time you want, in the way you want. My biggest request always is please write neatly. So probably a lot of what I have said, like I said earlier, are things that you already know, are things that has been there and it's been with you consciously or subconsciously. But I am trying to tell you that as an examiner, what I want is a neatly written, legible paper, a paper where the points to be made have been made, where the answers are to the question that was asked. Oh, one more thing before I forget. There is another tendency to start a new answer at the bottom of a page and then to continue it on the other side. Again, paper is not at a premium. It's so much nicer if you start every question on a new page. You finished one, okay, fine. So I know it's ended here. And as far as possible, not to write, put an asterisk, PTO, and then somewhere else put an arrow, continued on page 25. Everything that makes, like I said, my life difficult. And that difficulty irritates me when finally I have to mark you. In other words, be kind and considerate to the examiner. In the theory, by writing neatly, and in the clinicals, by opening your mouths and talking. In the clinical, that's not my brief here, but what irritates every examiner is you ask a question and then the candidate looks at you frightened. Absolutely. And the first question is always, it's a basic question. It's a question that we assume everybody should know, on which we are going to build up and ask more tough questions. And then you refuse to answer. You look at us frightened. Some people in their nervousness start smiling at you, but nothing comes out. And or you make actions with your hands. I make a lot of actions with mine. But unless there is a word to go with it, how on earth do I know what you know? So at every point in the exam, please remember the aim of that exam is to find out what you know, whether what you know is adequate for you to pass. It's adequate for you to be a good ophthalmologist, a reliable, safe ophthalmologist who can be entrusted with the care of patients from tomorrow. It is not to find out whether you know everything in ophthalmology, whether you know all the little nitty-gritty things, which you could go back and read. Like I always say, if you get your findings wrong, then there's no hope for you managing that case right. But once you've got your findings right, all you need to know is definitely, okay, what could be this? And you can chalk out your initial management, and you still have the option of going back and reading more about it. But every time I see a corneal ulcer, I can't go into the book immediately, though all of you are lucky in carrying devices where you can. I mean, I know how much luckier you are than all of us. All the knowledge is there on your smartphones. So I know how many times I will say, okay, check, find out whether this is what people have said about this, whether such a condition has existed. So I would advise that you use that also. And of course, please, when you're writing the theory, when you're giving us the answers, base it on proper textbooks. Along with the textbook, by all means, read journals, read updates, read every other small little thing that is helpful. But as a postgraduate, read the text. The text will be, of course, it's outdated by the time a text is written because they have to collate it all and put it together. So journals and what shall I say, reviews that come in journals will fill up that gap between one edition and the next. But at the same time, a text usually has to stand the test of time for the 3 years that till the new edition comes. So the facts that are put in there are far more likely not only to be standard facts, but facts that are accepted by most ophthalmologists and definitely most examiners. Don't base all your theory knowledge on journals and review articles or simpler ones rather than understanding what the text has to say. I don't think I have any more points to make. And like Gopal said, I needn't take you through the whole 1 hour. I hope it's been useful. I always enjoy talking, but anyway, what I've said helps you. Passing the theory, like most of you will realize, is usually child's play. It's the clinicals usually. So whenever you go and fail in the theory, it really upsets me because 50% is all you need for a pass, and that 50% what you're looking for is the standard, is the usual. Whereas if you try to impress us with more knowledge than was needed and omit to tell me what you thought, oh, this is so simple. Why should I say this is what the examiner knows? Sorry, the paper was not to test what the examiner knows. The paper was to test what you know. So the simpler you make it, the more you tell me in your words what you know about that condition, provided what you're writing is what I have asked you or the paper setter has asked, I'm sure that every one of you should pass the theory. Failing the theory is fear that what you want, what the examiner wants is more than something. And there will be the one odd question which you may not perform as well as the others. But there is no way that, but answer that question. See that you write something about it so that the examiner, if that is right, has to give you that 1 mark or the 2 marks, which will make all the difference. Don't spend all your time impressing us by what you know when there is only this amount of marks in my kitty to give you. I cannot give you more marks. And for many of these, I mean, there are monograms written on many of the things that will come to you as a short essay or a long essay. So there's no way that you're going to tell me everything about everything. But tell me what you need to know, the basics, the knowledge that is a must for you. And by 3 years, you must know, this is what I need to actually treat that condition. This is what the condition is all about. And if you still have difficulty with that, go talk to your teachers, talk to your consultants, find out about this condition, this answer. What do you think the examiner would want? And of course, for the vague questions, for the googlies where the evaluator is also doubtful, you get the benefit of the doubt. Where I wonder, I don't know what they had in mind. I give you the benefit of the doubt. Like I said, I see what the others have written. And if everybody has the same level of difficulty, we give you the benefit and at least you will pass that answer. Okay, so stop fearing the theory paper. Even if it is your Waterloo, you will be the Duke of Wellington, not Napoleon in that conflict. I wish all of you well, and I'm stopping. Ankit, I have finished.